Nurses are entrusted with the health and safety of our patients, and drug abuse with nurses is on the rise. And it not only threatens nurses and our nursing license, but it also threatens our patients as well. Patients are at their most vulnerable when they're in the hospital, and they need our protection. Each patient has the right to be cared for by a skilled professional who is not impaired by drugs of any kind. An estimated 6 to 8% of nurses have substance abuse issues. Do you want a nurse taking care of you or your loved one who is impaired by drugs or alcohol? I don't. I've worked in the medical field for more than 20 years now, and have personally witnessed colleagues who have lost their jobs, their nursing license, their livelihood, everything they have because of a drug issue. And most of the time it's caught at work. The use of drugs at work lead to poor patient care and accidents when they get caught. Whenever I say accidents, I mean the nurses are shaky, stumbly, they fall to the ground a lot. A patient complains of pain, and they'll give a partial dose to the patient and then a partial dose to themselves. And that's not okay because the patient's pain's not relieved. Today I would like to talk to you about the importance of drug testing for everyone that works in the healthcare setting. As a nurse, we're charged with a code to do no harm to those that are in our care. I feel like routine drug testing of medical professionals should be done to protect our patients from harm. And like I said, it's not only to protect our patients, it's also to protect ourselves and to protect those we work with. Nurses who are high on drugs will cause harm to those entrusted to their care, because when taking narcotics or any kind of drugs, it can affect your mental capacity. It'll make you slow to react. And in an emergency situation, you need to be ready to do CPR, to push those important drugs to save lives. You don't need to be fumbling around and not able to see what you're doing. Because a nurse is impaired mentally by the drugs, one might perform the wrong procedure, like put a Foley catheter in a patient that it isn't warranted, because you didn't check the patient's armband. You'll forget the basic skills. Or give the wrong medicine, like give insulin or a wrong dose of insulin to a diabetic, which could potentially cost them their lives. By doing periodic, unannounced drug testing on medical professionals will help to protect both patients and others in the workforce as well. Another problem with those who use drugs is that they cause health problems with those who choose to use them. So it causes health problems to you personally. It can even cost you your life. You could be at work and overdose, take too much medicine. Just because you're a nurse doesn't mean that you won't overdose. And you could potentially die, or pull nurses away from the patients that need them to take care of you because you made a bad choice. People who use drugs suffer from viruses like hepatitis B more often because of the at-risk behavior. They tend to miss more days of work due to headaches and other little things. So again, that puts more pressure on those who don't do drugs, because you're having to make up for those that do. Drugs can alter one's balance, leading to falls. I personally know a nurse who was helping a person to the bathroom and this nurse was on drugs, and fell to the floor across the bathtub and hurt the patient, hurt herself, and other nurses had to go get her up off the floor. Of course, she lost her job, which was sad, but still, you shouldn't use drugs. While on some drugs, it can affect your memory. You can be forgetful, and when you have trouble remembering things, you might forget to give a needed medication, like I said earlier, or hang the right drip on a patient, a cortisone drip, and cause heart issues. So I hope my speech has been helpful to convince you that random drug testing needs to be done on everyone that works in the medical field. My purpose in giving this speech was to convince others the importance of drug testing, because once it is identified that you have an issue, we can get you help before accidents happen and before someone is injured. Remember, when people's lives are on the line, those providing care to them need to be at their very best, and they don't need to be impaired. And to do that, to not be impaired, you need to not be on any drugs, because drugs can cause harm to others. Thank you.